Welcome to the McTox Curriculum, brought to you in collaboration with Western University, University of British Columbia, and McMaster University. This presentation is part of the McTox Curriculum, built for residents and fellows from PGY 1 to 5. Today's topic is about patient capacity. This presentation is brought to you by Wahid Al-Hazani and is about patient's capacity. By the end of this 10 minutes, as a learner, you will be able to define capacity to take healthcare decisions, understand presumption of capacity, discuss steps to obtain consent, and understand emergency treatment. Please note that this talk covers only general information regarding capacity and the ethics of treatment. However, every healthcare provider should be familiar with their own provincial and local healthcare acts governed in his or her jurisdiction. Case 1. A 26-year-old male arrives in your department appearing to be drunk. They are brought by his friends from a party. The patient has continuous vomiting. He is previously healthy, with no record of alcohol dependency. His vital signs show a heart rate of 122, a blood pressure of 110/66, a rest rate of 18, an oxygen saturation of 97%, and his temperature is 36.6 degrees Celsius. The patient looks drowsy and is vomiting. The rest of the exam is non-contributory. What is your impression of this patient? Based on implied consent, you started him on an intravenous fluid, provided him antiemetics, and ordered some blood tests to check his alcohol level. Knowing that the legal limit for drinking and driving locally is about 17 millimoles per liter, his ethanol level returns at 25.3 millimoles per liter. He does appear to be inebriated and has an unsteady gait. He is now asking you to go home because he has to go to work tomorrow. How are you going to approach his request? Why would you give this response? Are you going to grant him discharge with a taxi, or sedate him, or ignore his request as he needs to stay in the hospital? Or will you call his substitute decision maker? How do you approach this dilemma? A person is considered to be capable of making healthcare decisions if they seem to understand pertinent information about the treatment and also appreciate consequences of lacking the treatment. A person is presumed to be capable to make healthcare decisions unless there is reasonable ground not to believe so by the healthcare provider. A patient's capacity and ability to make healthcare decisions is not a permanent situation. It may change with medical condition and over time. Therefore, a person's capacity should be evaluated each time a new decision is needed, or if there's any change in the condition or a significant lapse in time. Furthermore, consent to treatment and a patient's capacity should not affect a physician's duty to restrain the patient to prevent serious bodily harm to themselves or to others. Case 2. A 56-year-old female is admitted to your department with a history of overdosing on her oral hypoglycemic tablets and has previous suicide attempts. Her vital signs are stable. You start her on D5 normal saline intravenously. In addition to oral food, her capillary glucose monitoring is normal. She expresses her refusal to stay in hospital and wants to go home against your medical advice. How are you going to approach her refusal? Healthcare providers should obtain consent prior to the start of a physical exam or any treatment. There are 4 elements of consent. The consent itself should be related to the treatment proposed to the patient. It should be voluntary and not obtained through misrepresentation or fraud. Importantly, you must remember that every consent obtained should be an informed one. That means the person must receive required information about the treatment that would assist in making the decision. Additionally, all questions and requests need to be answered sufficiently. Information that should be explained are side effects of the treatment, benefits of the treatment, alternative treatment options if available, and the consequences of not receiving the treatment. There are situations where the patient will not be able to provide consent due to capacity issues. In these situations, healthcare providers should make reasonable efforts to obtain consent from a substitute decision maker on behalf of the patient. A healthcare provider should be familiar with the ranking process of finding a substitute decision maker in his or her own jurisdiction. Importantly, obtaining consent should not delay emergency treatment. Also, remember that a substitute decision maker, if available, must be willing to serve as one and behave in the best interests of the patient. Emergency treatment can be administered without consent to an incapable patient if, in the opinion of the healthcare provider, the following criteria are met. 1. There is a medical emergency at that given moment. 2. Delaying treatment before obtaining appropriate consent will result in prolonged suffering of the patient or expose the patient to serious bodily harm. Let's return to our cases. In case 1, we are presented with a drunk young man who does not have any medical concerns. It is clear clinically and by lab results that he is drunk and lacks capacity to make his own decisions. In this situation, it is reasonable to talk to his substitute decision maker and discuss his clinical situation with him or her. The substitute decision maker may agree to drive the patient home and provide observation once the patient stops vomiting in the emergency department. Regarding the second patient with a suicide attempt who overdosed on her oral antihyperglycemic, it is reasonable in this case to explain to her that she had overdosed on a long-acting hypoglycemic and that there is great risk in her developing a hypoglycemic episode if she went home. In this case, it should be explained that she may die without continuous monitoring and treatment. If she is not convinced then, a discussion with her substitute decision maker, plus filling out designated forms to keep her in the hospital against her will until she is medically stable and cleared by the psychiatric team for her suicidal thoughts and attempts would be the most appropriate course of action. This concludes this presentation. Please now consider the following questions. 1. Give me 3 situations in which an ethanol level of 10 millimoles per liter can preclude a patient's capacity. 2. What is the age of consent in your jurisdiction?